Women and men, when they approach middle age, have different health needs, and they deal with things like stress in different ways as well. Dr. Tom Rogers from Performance Medicine is here with a very special guest to discuss managing healthcare issues as you grow older.
Thanks. It's great to be here today. I have a special guest, good friend over the years, Denise DePriest.
Thank you.
Wife of Greg, also a great friend. But
Sure.
Denise, over the years that we've got to know each other, you're not only my personal financial guru that I rely on for pension plans, etc., but you're also a patient, so you're also a middle-aged female that is going to be the topic of our subject today. It's my feeling, you know, I'm kind of known as a men's health doctor, but I actually see probably more women than men. They come to the doctor more often. And I especially treat baby boomer types like you and me. But I wanted to kind of pick your brain a little bit today on the stresses that women go through. In my opinion, women, once they reach 50 or so, they've really taken care of everybody else to their own detriment. Talk about women a little bit and their health and their stress levels.
I think that women typically put others first. I think you're right on point with that, Tom. And the one thing I see is we start out typically as caregivers with little children oftentimes, and then we'll go to work, we'll pursue a career, but oftentimes in later seasons in our life we end up caring for parents or siblings. So that cycle of caregiving really predisposes us to focus on everyone else but ourselves. So we kind of put ourselves at the back burner, and some of the subtle signs that we might see that would tell us you're tired, you're weary, you need a checkup. We're ignoring those oftentimes because we are geared to think of others. We're focused externally. But I think that one of the most important aspects of women's health is the fact that women can and should look inward and begin to listen to their body and develop strong relationships with support people and professionals such as yourself, that when I come into your office, I feel like I'm speaking to a friend. I don't feel like I'm meeting with my physician, even though I am. There is something really incredibly safe about that space.
I've always thought women are better people than men, personally. I really have. But
we could debate that.
Because they're just more caretakers, like you say. The family depends on them. And I think they do ignore themselves. Talk a little bit about stress, financial stress, especially around the holidays and the new year coming up. How does that impact your health?
Oh, financial stress is huge, especially with women. And I think that one of the factors is women typically are earning less than most of their male counterparts. Now, good news is this is the younger demographic of the 20 to 24-year-old wage earner. We're seeing that disparity, that gap close. But for women in their 50s, that's still a significant gap. So they're trying to do a lot with a certain fixed money or a budget, and the pressures of making sure that all the other needs are met, the budget of grocery shopping, health care, cars and what have you. I think that that's a big part of the picture, is just making sure everything else functions in life.
And I think when that happens also, women get to a certain age, they tend to gain weight, their hormones are going down, and women hormonally are more complex than men. I've always said that, and they are, but we can definitely figure them out and help them. I know as a woman who looks at hormones yourself that it benefits you.
Absolutely. And understanding that our body is a very complex system, knowing that we, regardless of whether it's financial stress or relational stress, that building strong relationships and support systems is probably one of the biggest factors of resolving some of that stress and bringing a sense of well-being.
Well, Denise, I want to thank you so much for those words of wisdom today. Ladies, if you have a problem, you're concerned, please come and see us at Performance Medicine.